What is the coronavirus? A coronavirus is a type of virus that usually affects animals, but occasionally can affect humans, causing mild illnesses such as the common cold. The virus that is causing coronavirus disease is called COVID-19. What are the symptoms of coronavirus disease? The disease has mild symptoms in most cases 80%, although it can be serious or even deadly how it is actually happening, especially in people who are older or have illnesses, like the flu. The data available so far indicate that mortality from coronavirus is less than the flu. Common symptoms are fever, cough, difficulty in breathing. Symptoms may appear between 2 and 14 days after exposure. How does the coronavirus spread? Transmission often occurs from person to person through direct contact or through the thick droplets of saliva that we expel when we cough or sneeze. A distance of more than 1 meter is considered safe, as these droplets cannot travel further than this distance. It is possible to become infected by contact with a surface or object that has recently been contaminated with the virus, and then touching your nose, mouth or eyes, although this does not seem to be the main route of infection. Only people who have been in contact with confirmed sick people, or who come from areas with community transmission are at risk. How to prevent coronavirus disease? By avoiding exposure to the virus. Avoid close contact with sick people. Avoid touching your eyes, nose, and mouth. Cover your nose and mouth with your elbow or a tissue when you cough or sneeze and then throw it away. Clean and disinfect objects and surfaces that are touched frequently, using a common household cleaning product. The use of a mask is not recommended as a protective measure for people who are not sick. Wash your hands frequently with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Always wash your hands with soap and water if they are visibly dirty. What do I do if I think I have the disease? Stay calm, stay home and contact health services by phone. Avoid close contact with other people so as not to infect them, and wear a mask if you have it. Take symptomatic medication, paracetamol, liquids, soft food.